So breast cancer is one among the cancers that is affected to female, mainly women, and it is the almost it tops the all cancers now, present era. Previously, it was cervix actually. Especially when we take India population, the first cancer which was very much prevalent was cervix. But now, because of our lifestyle changes and many more things which we have adopted from Westerns, so we are seeing patients more with breast cancer. So even in breast cancer, to tell about the cause, first is cause, etiology. So to tell about the cause, it is like uh, previously it is told that ladies get breast cancer who never had kids, who have not reproduced babies. So in the sense, there is hormones like estrogen, woman, which keeps fluctuating 15 days during their menstruation, I mean reproduction time. So when they have a regular cycle of periods, they are having estrogen and progesterone equally distributed among 15 days and 15 days. So when a lady gets pregnant, so that estrogen production is decreased in a lady who has a baby in her womb and 9 months. And then after the baby, I mean delivery of the baby, again this estrogen reduction in the body exposure is reduced for another 1 year or some time, like when till the time the lady feeds her baby effectively. So almost like 6 months of period, estrogen will be very less. Beyond that, when the milk production is getting decreased, the estrogen will increase. So with this, previously in our Indian scenario or anywhere, women used to have plenty of kids, like 10, 12 kids. So if we see, they were not affected with breast cancer at all. So at present scenario, we have decreased having kids to one or two, and we are seeing that patients, I mean people come with breast cancer, and mainly who didn't have kids at all, they used to definitely come with breast cancer. So this was the cause told before, and one more cause is obesity. More the obese, estrogen exposure is more again, so that is another cause. And similarly physical activity, lesser the physical activity, again our obesity will increase. So third one, and another one is of course the addiction, like alcohol and tobacco addiction. So this will also tend to increase the risk for breast cancer. So off late, when we see now recently, like even a lady with 25 years, who is a Muslim lady. Usually Muslim ladies get married very early, like less even when they are less than 18 years and all. And even these ladies come with breast cancer, and so they get married early, and they have kids also. Even they are getting affected. So in the sense, this concept of childbearing has gone away to much extent, that even younger ladies are coming with breast cancer. This I would put probably because of our lifestyle changes and food adulteration in our day-to-day food intake. Like we get crops which are much cultivated with insecticides and pesticides and many chemicals, and the farmers are want yield. They want to have a more yield, and they pump in so many things, like oxytocin in hen, so that it is shown bigger and it is fleshy. And similarly, even in injecting so many dyes and chemicals to make it look fresh. So these are the chemicals and the whatever injections and dyes are affecting our body, and we are more prone to develop cancer. So what all was the scenario before, that is not following. So each and every person can develop cancer. uh, So that is the present era now. So we have to be little careful about our food intake and other consumptions what we are having right now. And also one more is lifestyle changes. So to specially talk about breast cancer, nowadays women do not have gym activity. It's not that we had a gym building previously 50 years back and the ladies were going to gym. So now, but they had a gym activity at home. Like they had what to call to make rice into flour. They used to have that boulder and this thing to crush it, and so many things like to make idli batter or whatever. They used to have that grinding thing, and so many activities they were having, like even they used to go to field and work in the field also. So the previous generation women had lot of gym activities that we do not have now. Our physical activity is very much less, and a homemaker definitely can make a cooking within 30 minutes or 1 hour with the available mixie, grinder, and too many stuffs, microwave oven, and that, this, and all. So with this, our physical activity has come down, and nowadays the women are working and they want to be very fast in their cooking or food. And so we have all this Swiggy and so many things that we order it to home, and we never know what is being done in the cafeteria or restaurant, how it is being cooked, what all they add. So we are moving more towards depending on the restaurants and hotels, and also our physical activity has come down. So because of this, breast cancer is increasing. So otherwise, about the myth, it is not only females can get breast cancer, even males can develop breast cancer. So that is also increasing nowadays. Male are also affected with breast cancer. And other myths with breast cancer is, so similar to prostate cancer, yeah, breast cancer is little aggressive. It is not that low risk cancer. It is aggressive, and it can, in the initial stage also, it can spread to the other parts of the body. But we have so many medicines and technology that even stage 4 disease can be cured, and they have a good quality of life. Nevertheless, to tell, early the stage, early the treatment, better the patient. But not to worry, in case if they are diagnosed in stage 4 also, we have certain medicines and technology that we can treat them and they do good.